How did you feel initially when I was diagnosed with PCOS? Hey guys, what's up, Wagwan? Welcome back to my channel, BeingTami. Today we'll be discussing something that I think affects a lot of women all over the world, something that I think there's not much literature or video explaining, and I'd like to discuss my personal journey with this condition, PCOS, aka PCOS. So please stay tuned. So today with me we have Wayne, aka Hubby, with me today. Many of you might not know, but he's also a medical doctor, so he'll be taking the stance of both my husband and medical doctor. So he'll be answering a few questions that you might have about PCOS, aka PCOS. So welcome, Wayne.
Thanks for having me, YJ.
Yeah. So, Doc, what is PCOS?
Alright, so PCOS, also called PCOS, is a condition where there's an imbalance of the female sex hormones. So what results from this is women may have irregular periods or menses, they may have signs of hyperandrogenism, and they may have infertility or problems getting pregnant.
Okay, you use some words that, people might not understand.
Androgenism.
Okay.
Androgens are actually hormones, sex hormones. So in women we have estrogens, which are the female hormones, and androgens are the male hormones. Testosterone being the most common androgen, right? You following?
Yes. So
right.
So testosterone for males and estrogen for females.
Thing is, women actually produce testosterone as well. It's just
do?
Yes, you produce it in your ovaries and you produce it in your adrenal glands. The thing is, it's not as high in women as it is in men. With PCOS, women with PCOS tend to have a higher level of androgens, for example, testosterone. And because of that, they have different signs that you will see. And we can discuss that a little later.
Okay, so now that you have mentioned that, essentially it has to do with hormone imbalance.
Hormone imbalance.
Right. So testosterone, based on what I know, helps to bring across some of the symptoms, which you can discuss.
Right. It does help to bring across some of the signs of PCOS. So you see a woman and she has a beard or hair on the face, excessive hair on the face. That is a sign of high androgens. In fact, hair loss can be another sign. Male pattern hair loss. So at the front of the scalp, a woman might have hair loss in that area. A woman may even have hair distribution on the chest or other areas that you wouldn't typically see here on in a woman. So those are some signs. In fact, one of the reasons why women with PCOS have difficulty conceiving is because of the high testosterone. Testosterone sends a signal to the ovaries to not produce, to not ovulate.
Okay.
Right? And if you don't ovulate, you can't get pregnant.
Okay, see.
Right? There are other symptoms or signs, namely acne, which is another, it results from the high testosterone again, right? So you can have facial acne. A woman in her 30s, she just starts to develop acne, and you're wondering what is the cause.
Okay.
PCOS.
Okay. Some of the symptoms I was experiencing, I was having problems with my menses. It was very irregular. Also, what is very important for PCOS, which I'm sure you're going to talk about, is obesity. Truncal obesity is real, guys. If you have PCOS, you know that obesity is a problem. So for me, I started gaining a lot of weight in my belly area. So baby used to trouble me about my belly. You want to shed a light on that?
Right. So another thing that patients with PCOS have is insulin resistance, right? Now, insulin is a hormone that actually helps to keep your blood sugar regulated. It pulls glucose from your bloodstream. So when you have a situation where there's insulin resistance, then that sugar can't be pulled from the bloodstream. And what the body does is that it converts the sugar into fat. So that's why you have that fat being deposited around the abdomen. That's why you get obesity, truncal obesity. Another thing that does is that insulin actually helps to drive testosterone production, right? And it can contribute to infertility. So when the insulin is high, it can also contribute to infertility.
Okay.
Right. So, I mean, I'll get into treatment, but with that logic, you'll see why doctors prescribe certain medications for PCOS because of that insulin resistance.
Okay. Got you. Okay, so since we mentioned some of the signs and symptoms, such as the hair growth of which women can get under the chin, on the chest, we discussed the acne, obesity, the infertility. How is it diagnosed? What are the criteria for diagnosis?
Great question. So I like to make a distinction between polycystic ovaries and polycystic ovarian syndrome.
Yes, guys, right. There's a difference.
So somebody can go to the doctor, do an ultrasound, and they have a lot of cysts on the ovaries, but that does not mean that they have polycystic ovarian syndrome. I believe in 2013 there was a criteria that came out that actually lists the things that you need to look for to make a diagnosis of PCOS. You need 2 of the 3 things. So you can have polycystic ovaries on the ultrasound. That's many cysts on the ultrasound. I think it's 1 on 8 to 12. Can't remember the figure right now. Another thing that you look for is problems with ovulation, ovulatory dysfunction. So we mentioned some of those things like the irregular periods. You may have a woman who sees 6 periods for the entire year. That is not normal, right? Another thing is the hyperandrogenism that I mentioned. So you have the excessive facial hair, the facial acne. Those are the things that we use to make the diagnosis. So you just need 2 of the 3 things that I mentioned: the polycystic ovaries, the ovulatory dysfunction, and the hyperandrogenism.
Okay, we also mentioned hormone. Because do we look at blood tests to look for levels of androgen or other hormones? What question. Blood tests?
Great question. There are blood tests that look for this. They may be abnormal. You may see a high level of testosterone. However, just because you have a normal blood test doesn't mean that you don't have PCOS. Once you have those two of those 3 things that I mentioned, you can make a diagnosis of PCOS. It's a clinical diagnosis, meaning that the doctor will look at you, take a history, do an exam, and based on their interpretation of what they find, they may diagnose with PCOS.
Okay. I know you work as a primary care physician. In your care, have you seen persons coming with complaints of these signs and symptoms, and have you made that diagnosis?
Right. So, being your husband, it actually opened up my eyes to how common PCOS is. In fact, I was doing a Google search recently, and it actually said that up to 10% of women in the United States, of reproductive age in the United States, have PCOS. So that's a lot of women.
And Jamaica.
So it is a pretty common condition. I have diagnosed a lot of women with the condition. A lot of women come to me saying that, hey, doc, I've been gaining weight, I've been eating properly, I've been exercising, and I still put on weight. What is causing this problem? And the first question I ask them is, are your periods regular? And they will tell me many times that, doc, my periods are not regular. And that's how I get that light bulb, or that spark to say that, hey, maybe this is PCOS.
So you think that because I was diagnosed with PCOS, it has opened your eyes in terms of how many women are really affected by PCOS?
It definitely has. It's not something that, I learned about it in medical school, but it's not something I really paid attention to. It's not until somebody close to you has that type of condition you kind of really pay attention to it and you realize, wow, this is actually common and it's not really spoken about a lot. Back in the day, you probably have a woman and she's unable to get pregnant, and the community would look down on her and say, hey, this lady is barren, she's not able to bear any child, what is she doing? But I think a lot of times back in the day it was due to PCOS and it was just not being diagnosed.
Which, guys, is one of the reasons why I decided to do this video, because I realized that this is a very is a topic that has not been researched, attention has not been placed on it. It is a neglected condition, would you say?
Yeah, but I think in recent years, more and more attention is being paid to it. Certainly in the United States, but back in Jamaica, I think a lot more can be done in educating the population about this condition. And I think men need to know about it as well, because you may blame your spouse for not being able to give you a child when really and truly
they're sick.
there is a condition that is preventing that from happening. So I think more can be done in terms of education.
Okay, since we have discussed the signs and symptoms diagnosis, what are treatments? What are the treatment modalities for PCOS?
So just to say, there's no real cure for PCOS, but we can manage the signs, well, the symptoms and the signs. Yeah. So if somebody has excessive hair, combined oral contraceptive pills or some form of combined contraception, meaning estrogen and progesterone containing medications, can be used for that. If somebody, even anti-androgens, like there's a popular medication called spironolactone, can be used for.
Oh, that's used for high blood pressure, doc.
Right, but it can also be used for PCOS because it helps suppress the androgens. That's the male hormones that cause the hair on the face and so on. So that is one modality of treatment. If you're trying to conceive, then there are fertility medications that the doctor can administer. Clomiphene is a popular one, right? What was the other thing that I mentioned?
The thing about insulin.
Yeah, so insulin, metformin. You might be wondering, why am I giving you a diabetic medication for PCOS? Well, it goes back to what I told you. When you have insulin resistance, which is common in PCOS, the insulin resistance sends a signal to your ovaries to produce more testosterone, which sends a signal to your brain to prevent you from ovulating, right? Your brain actually works with your ovaries in causing ovulation. So the testosterone prevents that. So if you can suppress the insulin or make your body less resistant to insulin through giving metformin, then clearly the level of testosterone will go down and your body will be able to ovulate. Yeah.
Estrogen?
To ovulate.
Okay, to ovulate.
Right. So that's why doctors give you metformin.
There's also a popular belief among the PCOS community that they take metformin to help with the weight loss component of PCOS. Do you think that helps with weight loss?
It also helps because metformin is an appetite suppressant as well. So it does help with weight loss from that perspective.
So one of my questions that I want to ask you is, during my research and me journey with PCOS, one of the things that was emphasized in my treatment was the use of oral contraceptives, as you said, metformin. A lot of emphasis on diet, exercise, and going to the gym and keeping a workout. What do you have to say about that?
Yeah, I mean, that's actually the first step in treatment before you even administer medications. Diet and exercise. I would say a low carbohydrate diet helps, and certainly frequent exercise, 3 hours per week in the gym definitely helps, because what you really want to do is let your body be less resistant to insulin, right? Because it goes back to what I told you before. If you have more insulin, then more testosterone is being produced. It prevents ovulation.
Okay.
Right. So if you can get physically active and lessen your insulin resistance, then you'll be more likely to ovulate and increase your chances of becoming pregnant if that is your desire.
Okay, so just for my audience out there, can you just name the drugs that you are familiar with that treats PCOS?
All right. So I mean, there are many drugs out there, but the common ones, as I said, for fertility reasons, Clomiphene, that's common. To treat the irregular periods, to help to get them regularized, oral contraceptives, combined oral contraceptives are the way to go.
The Diane 35? Okay.
Yeah, the Diane 35 also helps with acne.
Okay.
That PCOS patients may have. So that is another thing, and the spironolactone, as I mentioned, that can be used for the excessive hair on the face and other areas.
And then we talked about metformin.
And metformin, yeah.
Right. So, as a doctor and as my husband, how did you feel initially when I was diagnosed with PCOS? What were your initial thoughts?
I mean,
no picnic, guys.
No, I wasn't thinking that. I didn't think it was a big deal, to be honest, at first. As a husband, you can be in a bit of a denial, even as a doctor. Like when somebody close to you has a medical condition, you kind of downplay it in a sense. At least that's what I do sometimes.
Yes.
But I really didn't see it as something that would impact the way I saw you as an individual. Certainly, as your condition progressed, like I saw you going through the different phases of it, like the abdominal bloating, the weight gain. I definitely empathized and sympathized with the condition that you are going through, and
Thank you.
I I definitely respect you as a woman for going through that ordeal. It was a difficult condition for you to handle. I
Yeah.
would say. It has made me more cognizant of how I look at my patients with that condition. I'm definitely more empathetic towards them.
Thank you.
And if I see a woman and she's overweight, I'm not going to immediately think that it's because she overeats. I'm going to probably think of a medical condition such as PCOS as a possible cause, and that's how my perspective has been changed.
Okay. So yes, guys, want to thank Dr. Palmer, hubby, for joining us today on our channel, BeingTami. Want to thank him for coming. Thanks, baby.
No worries, man. Simple thing.
Yeah. So yes, guys. This is from a medical standpoint. I'm a nurse, he's a doctor, so we wanted to give you a medical standpoint for PCOS. However, please stay tuned for part 2, where I will be discussing my journey, when I was diagnosed, how I felt, my reaction, my treatment, and how I'm doing now with PCOS. So please stay tuned for part 2. Remember to like, share, and
Subscribe.
subscribe. See you in the next video.